stress and anxiety disorders. Introduction. You learn about stress and anxiety disorders. These are disorders which can affect anyone at any point in their life, and many adults and children suffer from them. They are not always connected to a specific cause, but may result from general anxiety about life. We will discuss what they are, what might cause them, and how they can be dealt with effectively. Please remember that medication can only be prescribed by GPs, psychiatrists, or nurse prescribers. Topics to be covered: anxiety, acute stress disorder, generalized anxiety disorder, GAD, panic disorder, phobia, post-traumatic stress disorder, PTSD. Anxiety. Anxiety can be experienced by a person of any age, gender, and nationality. It is something we all experience at some point in our lives. You may be familiar with the fight or flight response to stressful situations. This sort of short-lived anxiety is common to all people. It becomes a disorder when it is experienced long-term and interferes with a person's ability to cope with daily life stresses. Anxiety is often about the brain misinterpreting or exaggerating stresses. A stressor is an experience or event which causes stress. This can lead to a person feeling overwhelmed and unable to cope. Acute stress disorder. This disorder forms if a person experiences something traumatic and is unable to find a sense of closure afterwards. The symptoms often begin within about 4 weeks of the trauma. They also usually resolve within about 4 weeks. Acute stress disorder can be dealt with if psychological support is provided. If untreated, it can lead to other major mental health issues, such as post-traumatic stress disorder. Causes. Acute stress disorder is the result of a traumatic event. This is often a life-threatening situation. The person will usually experience physical injury, though this is not absolutely necessary. Sometimes the injury will only be psychological. They will have recurring anxiety about the event in the weeks following it. People who have experienced a traumatic event should seek psychological help to ensure it is not having long-term effects. Symptoms. The symptoms can vary between people, but there are some common ones which you should look out for if you are concerned. These include anxiety, irritation without an obvious cause, restlessness and fidgeting, avoiding anything relating to the traumatic event, flashbacks, being easy to startle, problems concentrating, poor sleep. Treatments. Acute stress disorder needs to be treated to avoid more serious consequences. It is possible to completely cure the disorder if steps are taken quickly and support is offered. Treatments often involve using cognitive behavioral therapy. This involves teaching the patient coping skills, techniques the patient can apply when they feel distressed. Gentle exposure to the trauma or triggers, so the patient can apply the coping skills and overcome their initial response to the trigger. This can be supplemented with certain medicines, such as propranolol. Generalized anxiety disorder, GAD. GAD is a disorder which often develops quite slowly. It is often a result of the person thinking too much about a future event. They tend to worry about how the event will turn out, and struggle to function with daily life as a result. They will find themselves unable to deal with the anxiety, and may turn to alcohol or other unprescribed medicines to try and cope. Causes. It's not known what causes GAD to occur. It is believed that increased stress can contribute. If a patient is dealing with a lot of stress in other areas of his or her life, he or she may become more anxious about the future as well. There have also been tentative links made about an imbalance in serotonin and GABA, gamma-aminobutyric acid. Serotonin makes you feel happy and comfortable. GABA is responsible for limiting impulses from the nerve cells. If these are not balanced, they may contribute to GAD. Symptoms. The symptoms of GAD can be surprisingly severe. Like many anxiety-related disorders, it often shows itself through inability to relax, muscle tension, insomnia or poor or broken sleep, high levels of irritation or frustration, fast breathing, fast heartbeat, muscle pain, shaking or trembling, sweating. GAD can lead to other panic-related mental problems as well. It may even contribute to physical health issues, affecting the immune system and reducing the patient's ability to fight infections. Treatments. Again, GAD is often treated through cognitive therapy. This can be tailored to suit the individual and their needs. As with treating acute stress disorder, therapy often involves teaching a patient coping skills. It then requires slow exposure to triggers. The patient can begin applying their new skills so that they respond to triggers in healthier ways. Certain medications may also help reduce anxiety. These include antidepressants and anti-anxiety medicines, such as paroxetine and Buspirone. Panic disorder. A patient with panic disorder will experience periods of intense anxiety without warning or triggers. The patient may struggle to deal with life between attacks because they are constantly anticipating the next one. Causes. There are many potential causes. Panic disorder is often the result of an event in which the patient feared they might die. This leads to an increased fear of life in general, which can contribute to panic attacks. Some researchers believe that individuals have a genetic predisposition towards panic disorder. Other researchers believe it mostly stems from an exaggeration of triggers. It has also been linked with high levels of norepinephrine. This can heighten a person's sensitivity to anxiety. Symptoms. Symptoms can include sweating, dizziness, chills, panting, nausea, increased heart rate, feeling of dying, confusion or inability to think, feeling of pressure on the chest. Treatments. Treatments often aim to reduce a patient's concerns about the next panic attack. Cognitive behavioral therapy can help. The patient can then be exposed to potential triggers and shown methods for dealing with the resulting anxiety. Some medications include Prozac, paroxetine, and sertraline. The things that can be done during panic attacks. If you are suffering from a panic attack, remind yourself it will end. Focus on slow, deep breaths. Avoid fighting against the attack. Remind yourself you are not dying. Think about positive and calming images. Different people find different techniques useful, so look for ones which work for you. To prevent further attacks. Here are a few techniques which may help. Regular exercise to reduce tension and stress. Avoid high sugar, alcohol, and caffeine. All of these can worsen attacks. Avoid smoking. Learn breathing techniques. Take up yoga or meditation. Phobia. Phobia is a disproportionate fear of something. It will have a detrimental effect on the patient's life and may prevent them from accomplishing certain things. People can have phobias of social situations, specific things, for example, bugs. Agoraphobia, fear of leaving home. Causes. Phobias can be caused by a number of things, and it's often unclear what the cause is. Most commonly, phobias are caused by learning from a parent or sibling or influential figure early in life, a traumatic incident. Phobias may also be genetic, according to some scientists. Phobias can have a major impact on your life if you frequently encounter the object of your fear. Many people experience phobias, and they are varied and complicated. You may have no idea where a phobia stems from. Most common phobias. There are many phobias, but some of the most common include entomophobia, fear of insects; aviophobia, fear of flying; astrophobia, fear of storms; androphobia, fear of men; algophobia, fear of pain; acrophobia, fear of heights; claustrophobia, fear of confined spaces. Symptoms. As with many anxiety-related disorders, phobias can cause sweating, nausea, increased heart rate, dizziness, stomach upset, panting, shaking. These will usually be experienced when you come into contact with the object of your phobia. However, some people experience these symptoms just thinking about it. This is known as anticipatory anxiety. Treatments. It is possible to treat and cure most phobias. You may even be able to do it yourself, if the phobia is mild, through careful, gradual exposure to the source of fear. More complex phobias may require cognitive behavioral therapy or counseling. Similar techniques will be employed, but with the help and supervision of a professional. Medications can't treat phobias, but may help deal with the associated anxiety. These include beta blockers, antidepressants, etc. Post-traumatic stress disorder. Post-traumatic stress disorder (PTSD) is characterized by flashbacks, major anxiety, and nightmares about past trauma. The person does not necessarily need to have been involved in the traumatic event. They may simply have been witness to it. PTSD may be either acute or chronic. Acute PTSD means that symptoms occur within 6 months of the event. Chronic means that symptoms continue for longer than 6 months. PTSD can affect anyone who has lived through something traumatic. Causes. PTSD is caused by a traumatic event, but what specifically triggers PTSD in some people is unknown. Some researchers theorize that there may be a genetic predisposition. If you have a close relative who has PTSD, GAD, or depressive disorder, you are more at risk of developing PTSD. Some scientists suggest it is the result of an overactive adrenaline response. This is triggered when the patient thinks about the traumatic event, leading to the symptoms of PTSD. Symptoms. PTSD has very varied symptoms, and some are extreme. They include memory lapses, inability to focus, feelings of guilt, flashbacks, problems relating to others, sense of numbness, insomnia or poor sleep, avoiding reminders of the event, self-destructive actions. PTSD can also lead to alcohol and drug abuse, depression, suicide attempts, and problems with the immune system and heart. Treatments. Treatment needs to be tailored to suit the individual and will vary depending on how quickly PTSD develops after the event. PTSD can be treated through therapy. This could be cognitive behavioral therapy or other psychological therapies. These will often involve addressing the triggers and original trauma. PTSD may also be managed with medication, often to supplement therapy. This can include antidepressants to manage the symptoms. Dealing with PTSD is complex, but with trained help, many patients recover.